Hi, Catherine. It's Caro Overdulve here. Today we're doing 3 evaluations to see if there's any impingement in my client's shoulder, and this is Christian, my client. And basically, a shoulder impingement is defined as the most common complaint concerning the shoulder joint. It's defined as an irritation of the tendons which compose the rotator cuff as they pass through the subacromial space. This occurs as a result of compression of the rotator cuff tendons in the shoulder, causing pain and movement problems. So what I'm looking for is to have good movement throughout the shoulder and biceps through these tests. And what is normal is that there's no pain. What is abnormal if there is pain? So the first test that I'm going to do is called a painful arc test. And what I'm going to do is I'm going to ask my client to abduct his arms 180 degrees over his head. So Christian, if you can just lift your arms. And a positive test in this is if between, and they come down. A positive test in this painful arc test is if between 70 and 120 degrees if he feels pain. And do you feel pain in that area?
No.
In your shoulder? So pain normally in this test would be felt in the anterior shoulder or in the deltoid region. And again, a positive test basically is if there's pain between 70 degrees of abduction or 120 degrees. The second test we're going to do is called the speeds test, and this is basically to test to see if there's any strain or tendonitis along the long head of the biceps. The long head of the biceps is one of the 3 structures that is found in the subacromial space. So what we do for the speeds test is we basically flex the arm to 90 degrees and then supinate the arm so that his palm is facing upwards. And I'm going to place my right hand on his shoulder and then my left arm on his wrist. And I'm going to push down with a little bit of force, and he's going to match my force upward to by his wrist. And I'm going to hold for about 5 to 10 seconds. And a positive test if there's any pain or weakness in his shoulder, or if there's any pain at the shoulder or along his biceps. And Christian, did you feel any pain in your shoulder or along your biceps?
No.
Okay, so we have another negative test, which is good. That's what we want. That's normal. And the third test we're going to do is called the empty can test. And basically the purpose of this test is to test whether there is a sprain or tendonitis in the supraspinatus, which is in the shoulder. The supraspinatus is one of the 3 structures found in the subacromial space. So the first thing we're going to do is I'm going to ask the client to abduct his arm to 90 degrees and horizontally adduct his arm to 30 degrees. And then I'm going to ask him to internally rotate his shoulder so that his left thumb is pointing down. Okay, and that's as if he's emptying a can, and that's his empty can. That's why it's called the empty can test. And I'm going to do the same thing as the speeds test. I'm going to put my right hand on his shoulder, and I'm going to apply some downward pressure on his wrist with my left hand, and he's going to try to match my pressure. And a positive test would be if there's any pain or weakness in his shoulder compared to his other side. Normally I do both sides, but this I think is basically shows that a positive test would be if there's any pain in his shoulder. Did you feel any pain in your shoulder?
No.
Okay, so he didn't feel any pain in his shoulder. So we have 3 negative tests, which is exactly what we want. So I would recommend this. That gentleman is good to play sports, and there are no shoulder impingements with this client. Thanks a lot. Have a good day. Take care. Bye-bye.